I guess as I look back on all this work that I've been about for 35 years, that, and I follow Steve exactly with this notion that my world has always been about movement, physical activity. So when we talk about the issues we're dealing with chronic disease and all of its branches, heart disease, diabetes, whatever, throw in the obesity, whatever, in my estimation, it all trickles back to movement and physical activity, or the lack thereof. And you folks represent, you know, the cutting edge of what's to be, and the vanguard for where this is all can possibly go. And I think about this. I was sitting in the back there earlier thinking that, was this possible, this group, just even 5 years ago? I mean, to think of where you've come from and what the growth of this movement, and it is such a slow movement. Things take time in this area, and we'll get into some of the reasons for that. And is this, are we bright enough there for you? Can you see that? Okay, I hope this. And I'm going to walk through a couple things, and I am going to talk from the perspective of obesity. So Steve, I'm going to get somebody to get some cotton balls for his ears so he can get. I don't want him going off on me halfway through this thing, but a little bit about this notion that's going to cost you, because the reality of what we're fighting in terms of the scarcity of dollars is being driven by the fact that we're paying for so much of the sick care stuff that many of us 25 years ago were bargaining about. Folks, this is coming. We need, this is coming, and they turned a deaf ear to us then, and amazingly enough, the deaf ear is still being turned, despite the overwhelming numbers. How does train get so far off the track? Why is it such a hard sell, and what's a person to do? I offer this up. First day of school, 1957, Springfield, Illinois. 55 years ago. I think it's just right off of MacArthur Avenue. I think this is Butler School. And it's just amazing if you look at this with the leanness of the kids. A guy here called a patrol boy. And so things called bikes to school, walking. You don't see the minivans. You don't see the lineup of cars waiting to pick people up. So in 55 years, you think about that, what's happened to get us to the point that we're in today. So I'll revert back to this later on. So this notion of overweight and obesity, I want to just talk just for a second, because some of you may have seen these slides, some not, but they tend to be some of the more impressive slides that come out of the Center for Disease Control in the last decade or so. And a lot of it relates to this notion of body mass index, which is the indicator that we use to determine obesity, overweight, and such. And some of the formula stuff here, not so much important, but just the notion that body mass index is 30 or greater puts you in the obese category. So, knowing that all states collect this data through what they call the Behavioral Risk Factor Surveillance Survey data, and so we were able, over a course of time, to get a look at what's happened. And just some of this information here, that in 90, you can see that 10 states had this prevalence of obesity of less than 10%. No state had prevalence of equal to or greater than 15%. Then by 2000, no state had a prevalence of obesity of less than 10%. 23 states had prevalence between 2024, and no state had prevalence equal to or greater than 25. You can just see this progression of where this has gone. And what I'm going to show you is sort of that, but just walk with me here, if you will, back in 85, and then we just start the colorization of these maps. You can see the bar down on the bottom side there, the different types of blues, or the whatever color you want to call that, I guess, violet, whatever, where it represents percent of the adult population 18 years of age and older that are in this particular category, or weight category. So here you are back in 86, 87, 88, 89, 90, and then in 91 yet another color, as we picked up a couple of the Gulf Coast states, plus West Virginia and Michigan, where their population bumped to 15 to 19%, and you just see this starting to occur. And we get our next colorization in 1997, where now we've got over 20% of the adult population, and you can just see this progression as it goes here. Turn of the new decade, or the new millennium, 2001, we added another color. Now we've got 25%, and then we start adding some of these states, and it continues to grow and get up around. It was back in 2005, we went to the 30% level. And as we move up, you can just see here by the time 2010, the number that are at where the particular particular adult population of obese. The obese category, not overweight and obese combined, but just obese, 30%, 30 pounds or more overweight, where we're at as a nation. So it's just an amazing, and the interesting part about this is if this were Ebola, we would have minivans with people in white bubble suits flying all over the place trying to figure out what to do about this. So this has happened right under our nose over a course of 20-some, 20, 30 years or whichever. I draw your attention. Does it have a pointer?
There's no pointer.
All right. I typically do a few of these talks, to be honest, I do a few. So if you can see here, this light, the column on each particular segment here, the far right column in each one, represent, this is an interesting because this is that 60 and over crowd. And we heard us say it earlier here that the use of trails, we seem to see a lot of older folks getting on the trails. Well, this notion that right now one of the biggest population, the boomers, that are becoming overweight and obese, moving from overweight to obese. Large growth in that particular section right now. Here we're looking at this is kids, 12 or 2 to 19 type of age, and again we can see this, and the growth that has occurred. There's been some plateauing. I'm going to talk about that here in a minute. This again is the adult population over 20. You can see where we're at. You know, oftentimes we look at these things, and I've always believed that we talk about the combined obesity plus overweight categories, and I'm a big believer in that because one tends to move to another category. The obese becomes super obese, and the overweight moves shift to obese, so that when we start looking at an aggregate, I'll show you the Illinois numbers here shortly, we start to see some pretty impressive numbers. With kids, there's been some plateauing, and I'll get to that slide here. 2 weeks ago, they heard a lot about the weight of the nation. HBO has a special reign right now called The Weight of the Nation, a 3-part series, and talking all about these various issues. It was unveiled as part of an overall strategy to draw attention to this issue. I'm not so sure I've got some real mixed emotions about that whole concept of where we're going. We seem to be a lot of the same talking heads that have been at this for too many years, repeating the same information. I don't know what's new and exciting out there. But some of the stuff that becomes a little startling, by 2030, 42% of the adult population will be obese. Now that's down a little bit from a projection. It's a new model they've come up with. And again, some of these data set points, one can take a look at it, and you can kind of fiddle with the numbers here and there, and tweak them this way, tweak them that way. Oftentimes it's down to you're counting angels on the head of a pin here. I mean, the bottom line is they're big numbers. We're talking a lot of folks, a lot of very big people. There's been some leveling of growth in the overall, but there are upticks still occurring. So Bill Dietz from CDC, who heads up the Division of Nutrition, Physical Activity, and Obesity, talked about we may be at the corner, but we haven't turned the corner on any of this. With the kid, especially this notion of severe obesity expected to double over this period of time to 11%. So the expectation by 2030 is that those that are big are going to get bigger. And that pattern has been pretty consistent for the last 10 years or so. This notion about kids, 17% of children are obese, 17%. But there has been some leveling, although we are seeing slight increases in African American boys. So there's also folks out there saying, hey, these epidemics run their course. There's a theory that so what's caused it? If it's level, what's caused it to level? And intuitively, one sits back and thinks, gosh, we've done some refinement in school lunch. There's been some improvement in physical education. We've got all the good work that you folks have been about, from everything from rails to trails to safe routes to schools to all sorts of, but we can't get our finger on any one thing to say this caused this. But in the aggregate, we know that there's things afoot. But at the same time, it's still increasing. It's just not increasing at the rate that we're currently in. The Bogalusa Heart Study, and this one, this one is like there's just the test of time. Bottom line, if you're obese by the 8 years of age, 3rd grade, obese by 3rd grade, average BMI as an adult, 41.7, in a cohort they've been following for many, many years down in Bogalusa, Louisiana. And one would sit back and say, well, okay, well, we know now that through the Illinois Public Health data, working on what they do with their oral health exam work called Healthy Smiles, Illinois Healthy Smiles program, looking at 3rd grade kids, big sample, about 5,000, 6,000 kids, done it twice now. Numbers on those kids in the obese category, 3rd graders, 8 years old, about 40–42%. And we're pretty consistent with some of the other states that I've been tracking on this as well, so that the numbers are still pretty darn high, if you think about that. And I also throw in this study, the PDAY study, Pathologic Determinants of Atherosclerosis in the Youth. And this study began way back in '87, a bunch of centers across the country, and they were following up on deaths that were attributed to homicide, accidents, and suicide, and basically examined arteries and tissues from about 3,000 people that they had followed in this 15 to 34. They were including that as youth, but they actually had younger kids in the particular study as well. But what they started to see was this prevalence of the fatty streaks and fibrous plaques in that age span, and then it confirms that atherosclerosis, or the heart disease, in childhood, adolescent, all of the aortas and half the right coronary arteries in 15 to 19-year-old groups. So I'm setting this up because you have to understand what's coming. I mean, we're talking about a healthcare crisis right now, just dealing with what's at hand. You don't even know what's coming into the doorstep. The volume out there it will suffocate the system. And we'll get into some of that here in a little bit. I show this here too because this is some Illinois data from that BRFS that I talked about, and I'll draw your attention just to the obesity status down below. Bottom line here, when you look at the aggregate of all of this, about, I don't know what the different numbers are, 59, 61, 62%, whatever. When you look at these percentages, but you put it into perspective with actual numbers, that's about 5.5 million Illinois adults who are overweight or obese. And so when you start to talk about an intervention or a program, well, okay, what's Bloomington normal? 110,000? So that's 50 Bloomington normals. Now what's your program going to be like? It's going to manage 50 Bloomington normals. Not just making people aware. I'm talking about actually doing a program that is going to impact an outcome and change a behavior. What is that? Does anybody have that right now? Is that out there? So when you start to look at policy people, when you start talking about these things, they run for cover in a big time hurry. I've been with the Conference of State Legislators, the National Association or Council of State Legislative meetings and all this. And one was a massive 2-day obesity summit, and all these legislators from across, health committee members, leadership from Senate and House from across the country. End of the day, they looked down that barrel, said, we can't afford this. So what do? Well, let's get the soda out of the schools. That'll be the difference. You know, and I just have to throw my arms up and say, are you serious? You're going to get the soda? That's going to make... Do you have any data on how much soda is drinking in the schools before? Are you following any, tracking anything since you've enacted any of this work? How much of it's diet? Oh, by the way, when you talk about sugar-sweetened beverages, then you're going to pull the orange juice out too? Did the juices go too? So we glob onto these simple solution things, thinking that that's going to make the big time difference. And I don't know where you sit down on sugar-sweetened beverage issues and all that, and people can, that's a nice argument. But I would say, well, what about GM? If you're going to attack Pepsi, why don't you attack GM? They make these things you drive around in and you sit for hours in traffic. Or what about this thing called, my mind is just lost, Microsoft. I mean, these people that make these things called computers and these software games, and their kids sit. I mean, is that what? If you're going to attack, so why sugar-sweetened beverage? Well, because they had a momentum behind this thing and so on and so forth. So anyway, you can see what I'm talking about. Big numbers, folks. We're talking about big numbers and impressive kind of numbers. This is a study, there's some work that was produced back in '03 that I've stayed with forever. The Milken Institute out in California put this together. And the reason I like this is because it was a projection from '03 to 2020, or 2023. So it was this period of time which I said, well, you know, I'm sitting here thinking, I'm 62, I'll be 62, and if things go well, I've got about a little under 1,100 Saturdays left, assuming I don't get hit by a bus or something, you know. And you know, my goal is to be in pretty good health up until about the last hour. That's kind of what I'm planning on. And so when I saw this, I'm thinking, you know, this thing, I'll get to watch this. If I'll be alive when I can. Does this stuff actually play out? So you can see the types of diseases, chronic diseases that people are reporting at this particular time in '03, between the pulmonary conditions, hypertension, mental disorders, which is huge, heart disease, diabetes, cancer, stroke. You can throw in asthma and obviously obesity the driver of many of these particular issues as well. And then you look at this projected rise in that particular time period, that 20-year time period, and you can see these projections on where their growth, with a population growth of about 19%, and you can see these kinds of projections, and some of which we are right on track with. There's absolutely no question that we're on track with that. And we're especially on track with this, healthcare expenditures. This one almost dots out perfectly to what they said it was going to do. You know, so we can see this slope, what it's costing right now. Number one thing the Illinois General Assembly is facing, not just the Illinois General Assembly, but Congress and everybody else is facing. How are you going to deal with this healthcare thing? And what's absolutely amazing is that they look at this issue as though, well, this is we're going to pass this and get this. We're going to get it funded and get it paid for as though it's going to go away. It's like we build a road and now we're done. Now we go on to something else. It doesn't stop. The site, and I just showed you numbers earlier about what's going to be feeding the system over the next 20 years or more, and the volume of what they're about. So the scary part is that these numbers are just. I thought before the banking thing hit that I was absolutely convinced that that the healthcare thing would crush us. The banking thing got there first, but this is what everybody's facing. What are we going to do with these healthcare costs? How are we going to handle Medicaid, Medicare? Who's going to pay for this kind of stuff? What's realistic? My mom just passed away in October, pancreatic cancer. Interesting experience, the whole thing. I mean, she was in perfect health up until, well, reasonable health, up until about a year ago last April. And she came back from a cruise, lived in Orlando for the last 30 years, Chicago-based, moved south, Stonebird, stayed there, loved it, did all the things, walked, and all these, you know. Came back from a trip, had a little GI distress, went in, oh, by the way, you have a terminal disease. I mean, you know, two scans, and next thing you know, you had stage 4, stage 3 pancreatic cancer. Oh, you know, that's real, you know, life expectancy about 6 to 7 months, and that's pretty much what it boiled down to. But in the process of her care, just walking her through early phases of this, now she's 87. So we're making decisions here about chemotherapy and going through this, knowing that this is terminal. Can we just make her comfortable for a period of time? Let's give it a run. They give it a run. Well, then we went through a period and it started to spread. Well, we're going to change the meds. We're going to go to an oral med. The oral med dose, 10-day supply, $4,800. 87. And we just sat with my mom and said, Mom, what are we doing? What are you, quality of life issue? What do we think? What are we looking at here? What makes it different? Is this really what you want to be doing? And knowing that this end is there. And so it opened my eyes to a whole bunch of things, especially when I go into the infusion center with her. There's just a room full of 90 chairs with people with IV drips, all ages, mostly elder. And you get to thinking about the cost associated with this survival of some of this. And some people that are absolutely not going to make it. And yet our system has perpetuated some of this. And if she were in the Netherlands, it would be a family decision because we would have to bear the cost of it. And so we would make the decision, not based on Medicare taking care of her. It would be a family decision. Do you have the money to pay for this? And So where's all this going to go? It's scary. It's very frightening. It's even more frightening. I've got 4 grandsons, the oldest which is 5. It's more frightening about what I'm thinking they're going to be facing in the years to come. So get into some other things. And this is just an example. Like this is one I just snagged from Pennsylvania. The percent of their spending just on chronic disease, those diseases. I once was on a tour, and a guy from Australia called it the self-inflicted diseases. And they are. These are the preventable types of things. And so knowing full well that 96% of the total spending is spent on chronic disease issues, those that we can actually try and do something about. And the fallacy about that, though, is this, is that oftentimes we think that we're actually going to eliminate it. No, and I don't think we've done a very good job of selling that concept. The issue is we're just going to reduce it. You know, can we just minimize the number? If you cut it by 10%, if you reduce the incidence by prevalence by 10%, what will that do to bottom lines? How will that relieve money for education? How will that relieve money for roads? How, and on and on and on. And that's the issue where oftentimes we've got ourselves into a pickle with policy people because they don't believe that this is actually, you can actually change the course of some of this. Literally, in several years back, an appropriation hearing in the Illinois Senate, for an appropriation hearing for, at the time I was director of the Governor's Council on Health and Fitness. We were part of public health, but we had a separate budget, had to go before the Pro Committee. And we had a state senator from upstate New York, further upstate, said, well, Jeff, you gotta die of something. You know, he looked at me right now, you gotta die of something. Well, yeah, you're right, but the issue is, and I fired back with this notion, but what's the quality of that life up until that point in time? So, lots of education that's got to go on. So how did this thing get this far off the track? Well, obviously it's not. It is about that much of a wreck, as I'm looking at it right now, living in Springfield on a daily basis and listening to all what goes on. But beyond these usual suspects that we can point to in this whole issue about overweight and obesity in children or whatever, and we go down the list, whose fault is it? You know, where does the fault lie? Well, obviously there's enough blame to go around for any one entity. And part of the problem is that there's different groups that have different power structures that can attack and do things within these particular groups that makes this all a little more confusing. And that's why it's easier for me just to sit back and say, you know what, I can zero in on one thing, and that's about getting my rear end up off the chair and go out and actually move. I don't care what, just go move. And unfortunately, we're a couple generations into the process right now where we actually have kids that do not know how to move. They do not have the basic motor skill development. It's never been taught to them. And early on with these wee little kids, that's exactly the way it plays out. The elements of hop, skip, jump, throw, catch, kick, swing are taught. And we have this belief that that's automatic, people pick that up automatically. And it's based on the concept, forgive me ladies, but it's why girls throw like girls, because no one ever taught them otherwise. And so you have a whole generations now of kids who bail out because they can't play in the reindeer games. They don't enjoy it. And so what do? They migrate to those things that they do have success with, and it's using those thumbs. They're the fastest thumbs in the world. They're great. They can move, but they sit. They do not engage because they don't have any fun doing that because they've been made fun of. Last pick for the team. All these kinds of things, that cycle just continues on and on. So, a few observations from the field. The siloing. This drives me absolutely bonkers, that the federal dollar streams, state dollar streams are in the various silos. On your right, we've got cardiac disease silo, diabetes silo, cancer silo, whatever, asthma silo, and oh no, we can't have a physical activity program that bridges all 3 or 4. No. It has to be a physical activity program specific to cardiac disease or specific to diabetes. And unfortunately, some of the appropriation language that comes out of Congress and the authorization language stuff, it puts them into a bind because they have to go by what CDC's told, what's in this authorization appropriate language. I always get it mixed up which is which. Andy, you know how that figures, but part of the problem is in that language, and they're stuck as to how the money can be spent and what can be coordinated or not coordinated. And that still exists today. And so this siloing effect, rather than looking at this, we should be doing stuff like this, where we have all sorts of intersect points, where we connect the big bins with the smaller bins, and we create different ways of reaching one another. We're starting to see this. I mean, there was a movement, probably within the last 5 years, where this structure was starting to become a lot more prevalent. And it's still out there. But what's happened right now is the retraction of the economy and scarce dollars. And now all of a sudden, not only are they back to the individual silos, they're pouring more concrete in them. They're hunkering down even deeper because they're protecting their turfs. And it's been amazing for me on a national basis to see that happen with organizations we work with from across the country. And it gets to the notion of what we were talking about, what Steve was talking about earlier about outcomes, data, lack of information. And those groups that have the ability to generate that and sell their case are going to be in a much better position down the road, and we'll talk more about that. This notion of policymakers, some observations from the field. We absolutely have no surveillance as to attitudes, beliefs, and knowledge for what makes these folks tick as it relates to physical activity, nutrition, obesity issues. And here's a prime example. With Illinois being one of the few states, the only state with K through 12 daily physical education mandate, is not enforced exclusively, but it has been on the books since 1961. Data out there right now, absolute, irrefutable data, not just physical activity, but fitness, the outcome of physical activity, relationship of fitness to academic performance, irrefutable. Data's clear. Kids perform better, math scores are better, overall test scores are better, grades are better, truancy issues go away, up and down the line. That's just the academic side. But then you throw in, oh yeah, but by the way, these kids get healthier. You know, they actually do improve. Asthma goes away, the weight goes down, all of a sudden asthma goes away. So you put that into there. And then you get into this notion, oh, and by the way, we also see reduction in gang issues, issues of drug use, reduction related to performance, physical fitness performance. So you put a superintendent of a school in a room, put that before him or her, and they still look at you like with deer in headlight look. Well, we have to worry about it. We have to get test scores up. I just told you. I just gave you an example of how that works. Still don't get it. I mean, it's still this constant sell. It's non-stop. That's just the work that we have to be about. Just like the work you guys have to do and ladies have to do as you battle these issues on communities and decisions and city councils and ordinances. And Steve said it earlier, and Andy said it earlier. It's just ongoing. You have to be relentless on that, and that's the same with these issues as well. So what drives them to action? Is it universal? Is it regional? Is it local? I don't know. We barked at CDC for a long time about getting this up on their radar to start to figure this out on a regional basis, on a national basis. And is it different at a state level versus a county level versus a city level? Are there patterns of what makes them tick? What makes them react to why they would want to do a bike trail? What do we know about why they did that? What was the driver? Was it economics? Is it the combo of economics and health? What is it? So these are things that we just don't, we're not real good at yet, but there are things that we've zeroed in on for sure. This research to practice shortcomings, lots of good things out there that are done in the Howard Halls of Ivy across the country, and if you've got 3 principal investigators and 9 graduate students, you can make this thing happen on a college campus with college students and college faculty, and even with residents in the college town. If you try to translate that out to Big Neck, Illinois, or to Cairo, Illinois, or whatever, it starts to fall apart in a hurry. So we don't do a very good job of research and practice. We need to be spending a little bit more time, because I know there are things occurring in communities across this state and across 3 states that I work with between Illinois, Kentucky, and Tennessee. We need to take a look at the practice and come back to the research. Take a look at what's actually happening and start to figure out and support why they are being successful in the work that they do. Then this quintessential battle, where do we put the resources? And it's always this notion, you build the fences at the top of the cliff, or do you put the ambulances in the valley below? I mean, that's the age-old saying about that. So where do you do that? We tend to be a society that puts them here. You know, those fences, well, you know, the upstream work. We tend to just say, get downstream and fish them out when they go by. That's what we'll deal with. That's kind of what we're dealing with right now. Not worry about why they're jumping in the creek. We'll just fish them out as they float by. And so that's an issue we face. We're going to have to figure that out. This other one, I got too ahead of me here, but the cost effectiveness of prevention, this is a tough one. This is a real tough one. Because I can assure you that we've got people on Capitol Hill, we've got people in the Illinois General Assembly that simply, as I said earlier, they don't believe this stuff works. They just don't believe it. And they also think that if you put this cost, if you do prevent, what did it really cost you to prevent that? What are the real numbers on cost of prevention? And I don't think we've done a very good job of building the case, of building the messaging around this issue. We're getting better at it. But as I said the other day, there was somebody that talked about, there's a bill going through the Illinois House Senate right now. It's going to probably pass out this week. It's going to be hopefully signed by the governor, Senate Bill 3374, which is calling for the creation of a physical education task force that's going to go back and take a closer look at the physical education curriculum requirements in the state of Illinois and enhance and improve them and get them in line with more current thinking about health and wellness and fitness and that type of thing. Less about throwing out the ball and team things, more about personal health and responsibility for your health and how you go about that. And they'll be making recommendations to school districts in the summer of 13. Recommendations, not necessarily saying that the districts are going to have to do it. There's nothing mandated by it. But it's going to start to set some gold standards out there that I think Illinois is going to be way out on the point on this on a national basis. So part of us, well, why would we even get excited about this? And they said, well, why did it get through the General Assembly so quickly? Well, because they presented it as a revenue-neutral bill. It wasn't going to cost anybody anything to do this. And to get it through, they did that. So, okay, I guess I can get with that. Problem is, we've done that for so many times, so often, that this fact is, last time I checked, I think it's about $150K for open heart surgery, I think. It's around $150,000. So that costs money. Why would we expect that trying to manage 5.5 million adult, obese, overweight adults, why would you think that would not cost money? You know, it's just, that thinking gets us into trouble so many times. And then, of course, this last point here, with Steve and others, and Mark Fenton, who's one of the major advocates of walking and biking across the country, this notion that physical activity has been dwarfed in the conversation. Absolutely believe that. We've lost it to the nutrition world. Some people call them the food cartel, the nutrition cartel, whatever you want to call them. And I've been screaming about it for a long time, trying to get somebody's attention to this notion that look, this is to the point now where we're starting to look at just strictly a physical activity coalition in Illinois that would be put together that, I don't care what the nutrition world says, I don't care what, we're just going to stay focused on movement. All inclusive, biking, walking, running, whatever. We've got to get people moving, and that's the issue. And some will say, well, it's not that simple. I know it's not that simple, but I know one thing. I go back to that picture from 1957. And I knew there was a lot of movement because I was one of those kids. And not me personally, but in 57, the south side of Chicago, that picture could have been me. But it was all about movement, biking, walking, playing ball, moving all the time. And that's gone. And that is literally gone. So that's, we're going to have to get back to some of that. So why is it such a hard sell? Well, this notion of limited data. We do not do a very good job of this, and I attack all the time my friends in Safe Routes to Schools. Look, I can walk from here to Beijing, and the point is it good? What are they doing after? What are we doing in schools? Are we improving anything as it relates to daily physical education in schools?
we have to start to get some hard numbers from people that are start to drive outcomes on some of this stuff. We have it now with the fitness relationship to academic performance. We have it with fitness relationship to health improvement. We have it, we know full well, obese as a kid, obese as an adult. Those tracking things are all, we have to message this stuff a whole bunch better. And that's the other thing, that these messaging, we're all over the board in our messaging. You need to be aware of that and be able, and it's hard for the general public to sort this stuff out. It's hard just from the physical activity side of it, let alone what is in USA Today that you can't eat now. You know, it's like the what you can't eat or what's good for you du jour, today versus tomorrow. So we've up and down this from the nutrition side of it for so long and confused people for so many years. It's a no wonder that they just throw up their hands on these issues. So the consistency of the message. This is the other thing here. This aggregate data that I just talked about earlier. It's frightening. But apparently, there's not an urgency to it. What would be an urgency? In my mind, we need an outbreak of 5-year-olds going to the ER with coronary artery disease attacks, MIs. If we started seeing those types of things, then the response, the problem is this stuff doesn't kill you until later. So it's this delay, we're into this delay thing, or I can take this pill, or I can manage this over time. Well, it's where we're at today, folks. So this notion of urgency, what's the urgency? What's the message of urgency that can we actually coalesce on a single message of urgency? And then I talked about earlier, the attitudes, beliefs of the decision makers. We certainly have to get a better handle on how to go about that. So the absolutes and all this, so what's a person to do? It's going to take time. This didn't happen overnight. It's not going to reverse itself overnight.